My name is Jacob Hendricks, and I'll be introducing our topic as well as the client we use for our scenario. This is our postural and movement analysis, and we looked at a client named John Doe. So John Doe works a very sedentary job, working at a desk for the past 5 years, so that would definitely be in question of his athletic ability. He does have some recreational sports history. He grew up playing football in high school, but stopped after his senior year. To get some steps in, he does go on 1 mile evening walks 3 to 4 days a week. We asked John of his medical history within his family, and we found his family is free of any disease or injury. We gave John a PAR-Q form for his risk health assessment, and as you can see, he answered no to all the questions, inferring he is ready for exercise and there are no risks.
So hi, my name is Milka and I'm going to be covering the static posture analysis. And we're going to be first starting off with the anterior view. And here I have pictured from one of the previous activities this angle, and some normal findings that we could find from this would be our foot and ankle. So those will be pointed straight and parallel to each other. And then with that, our knees will be aligned with the toes, so kind of just straight. And then our lumbo-pelvic hip complex, we will have the PSIS. They're going to be leveled, and then our shoulders as well, leveled in a neutral position. And then along with our head would be also in a neutral position as well, kind of just straight. And then some abnormal findings that you could find in this is the foot and ankle wouldn't be flat, so kind of like arched or like pointed up, and then also externally rotated, so kind of leaning inwards or even kind of pointed out with like a curve. Our LPHC kind of at a tilted angle, and then our shoulders will kind of be elevated, or also we'll have rounded shoulders, which in other views, it's more like you're able to see it more. And then our head would be tilted or rotated as well. And then some overactive muscles that you could see in this would be the upper traps, which causes that shoulder tilt, which you could kind of see in my image. And then the next overactive muscle would be the tensor fascia latae, the TFL, and this could lead to knee valgus. And then an underactive muscle would be the rhomboids, and those are responsible for pulling the shoulder blades kind of together. And when weakened, it could cause limitation in our range of motion and also cause that slouch, like kind of upper posture. So the next static posture analysis I'm going to be covering is the lateral, and there I have pictured from a previous activity as well. And then some normal findings that you could find here would be the foot and ankle. And the legs will be vertical at a right angle to the sole of the foot. So kind of just straight and like curve like that. And then the knees would be at a neutral position. So kind of how previously we said align with the toes. So kind of just that straight angle as well. And then our LPHC, the pelvis will be at a neutral level, and then shoulders at those will have a normal spine curvature, and then the head will be at a neutral position. And so some abnormal findings that we find here would be the foot and ankles are not flat. The knees will be kind of flexed or hyperextended, so not kind of straight. And then the LPHC, the lumbar extension and lumbar flexion, and then shoulders would be rounded instead of that normal spine curvature, or also it would be excessive kyphotic curve, and then the head would be excessive extension. And so for the overactive muscles, we have the psoas, which would kind of have a curve to that lower back, and then our pectoralis minor, which would cause the rounded shoulders. And then an underactive muscle will be the serratus anterior, which kind of contributes to the rounded shoulders, as you can see kind of pictured in mine, and that could cause improper scapular movement.
Hey guys, my name is Jacob Zetaceto, and I'm going to be going over the transitional movement analysis of the overhead squat. To start out, we're going to look at the anterior view of the overhead squat. From this, we can see that there is no valgus or varus of the knees. The feet are not going in or outward and not flattening. So therefore, there's no evidence of any overactive or underactive muscles. So then we will move on to the lateral view. When looking at this, I see that there is an excess lower back arch and the arms are falling forward. So some reasons for the arms falling forward may be possible overactive latissimus dorsi or pectoralis major/minor, pulling the shoulders forward, and possible underactive for that could be the lower trapezius not engaging in pulling the shoulders back. And also, for the excessive lower back arching, the main reason could be an underactive glute max. When looking at the rear view, you can see that the lumbopelvic region is stable and that there is no shifting of hip hike or drop. So we can say that this is a stable area. When looking at another research article about the overhead squat analysis and comparing it to a treadmill running, it was shown that there is a high correlation between the midfoot stance and the feet in the overhead squat analysis. And if there is a pronation in this, then there will be a pronation while running, which makes sense. And that is all I have for the transitional.
Hello, and I am Jair, and I will be going over the walking gait in this presentation. So again, some common observations that we'll be looking for is for an ankle. Do you see pronation or external rotation? We're gonna look at knee alignment and is there a lack of alignment in the knee or is there inward movement, which I think we do see in this video. We are also going to look at the hips, do you see some hip drops or excessive tilt, shoulders, we're looking for that rounded shoulders or lack of arm swing. And then we also have head muscles that we will be discussing also. But yeah, let's look at the video and see what observations we can make in this video. As you see right there, I believe that you do see a little bit of foot pronation, and that could be a result of the peroneals. Not only that, but also a lack of alignment. You can kind of see the knee going inwards during this. And you kind of do see a hip drop as well. And then not only that, but you could see rounded shoulders here and a little bit of a forward head posture. And all the overactive muscles is the hip flexors, the peroneals, and the latissimus dorsi, while all the underactive muscles would be the gluteus medius, core stabilizers, and the posterior tibialis. Thank you.
Hello, my name is Francisco Escamilla, and I'm going to be presenting the part of our movement, which is going to be the transitional movement analysis on the single leg squat. In the video that we have on the side, we have our client caving in the knee of the lingual leg squat, and as well as dropping the hip once they're going into the squat position. Some of the possible overactive muscles because of the knee could be the lateral gastrocnemius and the adductor complex, which is the same side as the stance leg. And then once we go into the hip drop, whenever you're going into the squat position, possible underactive muscles could be the gluteus medius or maximus because of this, and then as well as the quadratus lumborum. Same thing as before, same side as the stance leg.
Branca, and I'll be going over the land. Hi, my name is Jake Branca, and I'll be going over the landing error scoring system assessment, otherwise known as the LESS test. I'll be going over what it is, how it works, and then most importantly, how it relates to our client. So the LESS test is a dynamic movement assessment used for identifying improper movement patterns during the jump landing task. So when a person is jumping up and landing back on their feet. This test is done by having the client stand on a box that's placed 30 centimeters high and then jumping forward to a piece of tape, landing on that piece of tape, and then immediately jumping up again from there. The tape is actually placed out about half their height and distance away from the box. Like I said, the client's instructed to jump up or jump out towards the tape, land on it, and then immediately jump back up and land on their feet. And then they repeat that 3 times. So the cameras would be placed in front of the client as well as to the side of the client. These are the best 2 angles for the exercise professional to identify any muscle imbalances or any improper movement patterns with that associated with that test. So here we can watch the video of me performing the test. Okay, so as you could see, some of the compensations that I was making for this test is my knees would cave in a little bit, which you could see from that anterior angle. Another one is that I was leaning forward after landing after the second jump back to the ground. I had some excessive forward lean. And then you could tell that there was some instability upon landing at my feet and ankle joints. So the overactive muscles and underactive muscles associated with the LESS test are going to mostly be in the lower extremities. At least those are the ones we're focusing on for this client because his goal is to be able to walk. So at the hip joint, some of the overactive muscles will be the hip flexors, and adductors. And then underactive muscles at the hip joint are like the gluteus medius and maximus. And then at the ankle joint, which is another significant part of this test, some overactive muscles would be your calf muscles, the gastrocnemius and the soleus, as well as the other side, which is the anterior tibialis. The reason that these muscles would be overactive or underactive are likely going to be from his desk job that he's had for 5 years. Having your hips constantly flexed like that are going to create overactive or shorter hip flexor muscles. And then, and then having your glute muscles constantly stretched like that will create longer or underactive muscles. And it is obvious with the way that the test is performed here. So this test relates to our client John because John has had a desk job, like I said, for many years, and it likely has created muscle imbalances in his lower extremities that are creating pain or discomfort. So identifying the severity and imbalances using this test can help the exercise professional more accurately prescribe exercises that will help John correct and improve his ability to walk and ideally take away pain and reduce any injury risk. So that's the landing error scoring system. Thank you very much.